is specifically, how did the pandemic help medical billing companies? So let's talk about that for a second, because a lot of people wonder if this is the right business to get through. I think some of you have already typed in, let me know that you hear me, so I'm going to skip that slide. Back in 1987, my wife, Linda, pictured here, started doing medical billing here in this Dallas-Fort Worth area where we've lived all of our lives. And she did so well that we were able to eventually, I quit my job. We built a new home. We bought a couple of new cars. And literally, we had our friends and relatives asking, how in the world are you doing that? Because we know you never leave your home. We did it all right out of our home. And so we started actually teaching other people how to do that, and developed a package. We call it a business package that includes the training that you need, the certification, the software platform, and of course, more importantly, the marketing know-how, how to go out and sign the doctors up. Now, if you just want to check me out personally, I've written 3 books that are shown here on the screen. And one of them that we're going to talk about is right there in the middle. Now, you can't see that very well, so let me just read that subtitle to you. It's called A New Thriving Medical Practice, How to Get Off the Hamster Wheel, Work Smarter, Not Harder, Generate More Revenue, and Enjoy Greater Career Satisfaction in the Post-Pandemic World. Folks, this book is, it's a bestseller as far as we're concerned. The doctors who read this realize that they need help to survive in today's post-pandemic world. I wrote this with Dr. Vicki Ratner, who I'll talk about just a little bit later, and the other 2 books. You can find all these on Amazon if you just want to go search that out. I'm also on the editorial board of a magazine that's actually published each month, and it goes out to 40,000 people. Anybody who's anybody in billing and coding subscribes to BC, that's for Billing and Coding magazine, and it's something that I have articles in on a regular basis. I'm also the co-founder of MERMA, the Medical Revenue Management Association of America, which we'll talk about a little bit later as well. I mentioned that our system is a cloud-based system. It is a completely agnostic system when it comes to computers. You can run it on Windows-based computers, Apple computers, Chrome computers. It runs on iPads and tablets. It runs on laptops, and yes, even on your phone, you can access our system. And that's all without having any apps that you have to install. It literally runs through any browser. So we'll talk a little bit more about that, but folks, you can check more out, of course, about our system on our website. If you haven't been there, absystems.com. Maybe you were just invited to this webinar by a friend. We've won many awards for our platform, as you can see pictured here, and we have technology partners that we'll talk about a little bit later as well, that provide all sorts of ancillary services that you can offer to doctors, as well as the billing. Some of them are pictured here in this graphic. It includes being able to bill for dentists as well, to do virtual care, to help doctors with their compliancy, HIPAA compliancy, and many other services, again, that are all described there on our website. So let's get started on how did the pandemic help medical billing companies? Well, we've been through a lot as a company. As you can imagine, for the last 23 years, we had to go through that inflationary, recessionary period back in 2008. We've also gone through the Affordable Care Act, and we've dealt with coronavirus as well. And the reason our business owners are thriving in spite of all these things is because, well, it's the medical industry. All I can explain to you is that the medical industry is a very solid business to get into. It's 1/5 of our entire economy. And as long as there's human beings that get sick and they go to doctors, the doctors need to get paid by somebody. And you can be that person that helps them get their money from the insurance companies and from Medicare by a simple process of just submitting some medical claims. Now, a lot about what I'm about to talk to you about came from these publications, Beyond COVID-19, the Other Healthcare Crisis Sweeping the Nation. That's the medical practices themselves as the crisis. What the pandemic has taught us about modernizing practice administration and how COVID-19 is shaping healthcare technology. These are all available on the sources that you see there at the bottom of the screen. So you can certainly welcome to look those up. One of those sources says that there was a 65% increase in telehealth demand in 2020. And it's even risen since then. You can imagine people didn't want to go in to see the doctor because of COVID. And so the doctors figured out, well, they'd been using telehealth for some time, using the telephone, for example. Now they've used things like Zoom and other video technology to connect with their patients. There'll be 200 million telehealth visits by the end of this year. Now, here's a quote. It's kind of long here. I'm going to read it to you because I want to talk about this as we go through it, because it's very important that you understand why this is important for you and other people who are trying to get into medical billing to understand. It's from one of the publications that I just showed. And it says this increase in demand for telehealth services is largely in response to efforts to contain and curtail the spread of COVID-19. Easing of regulations for telehealth visits and increased insurance coverage under Medicare, as well as private insurance policies, have made widespread adoption possible. Telehealth reimbursement models are now on par with in-person visits under many insurance policies. Telehealth appointments help medical practices maintain financial stability. Now, let me circle that because that's what I want to talk to you about. Folks, you can actually help doctors stay in private practice and maintain their financial stability because of what's happened with the COVID situation. Look at this quote. Private practices have seen a significant decrease in visits and revenue across the country. Even as some areas have eased restrictions, patients remain hesitant to visit their healthcare providers. And you can understand why that is. Some people are still worried about that and other things that might come along. So they would rather do it by telehealth. Private practices have seen a significant decrease in visits, it says, and revenue across the country. Now, this is why this is important, folks, because what our business is all about is helping doctors to increase their revenue. And so even as some areas have eased restrictions, it says patients remain hesitant to visit the healthcare providers. Of the 2,750 primary care physicians surveyed by the Primary Care Collaborative, 79% reported seeing fewer patients in person, but doing more outreach via video and phone. However, this shift does not necessarily translate to reduced overhead costs, which might make up for decreased revenues. 39% of the physicians reported overhead costs to be about the same as pre-pandemic, while 31% indicated that they had increased. So their costs, their overhead has either remained the same or increased, and yet the revenue has gone down. Look at this quote. Primary care physicians aren't the only ones reporting a decline in patient visits. In the first months of the pandemic, healthcare revenue decreased by nearly 50%. Now, imagine you as a doctor. Remember, a practice is just a business, really, right? And as a business, what if your revenue decreased by nearly 50%? That would hurt, wouldn't it? And that's why our business owners are thriving, and some of them making 6- and 7-figure revenues in their business. I'm going to show you and prove that to you here in just a moment. And this chart says 81% of physicians surveyed in July and August said revenue was still lower than pre-pandemic. This was last year, 2021. So folks, we're in the right business at the right time. Forbes even had an article called Small Business Booms Post-Pandemic and New Ways of Doing Business. Nearly 27 million small businesses in the United States generate about 50% of our gross domestic produce, which is why they play such a crucial role in the survival of our country's economy. Even after the first year of the pandemic, there actually was a small business boom, according to a recent White House report. So folks, this is a good time to start business. Sometimes as we go through as a nation, some of the tougher times, right after those tougher times is a perfect time to start. In fact, Entrepreneur Magazine says a new home-based business is started every 12 seconds. That's 7,200 new businesses started every day. That's 300 every hour, or 5 every minute. So you just need to think seriously about maybe it's time for you to start your own business. 427 billion per year is made by home-based businesses. Folks, this is the trend, and that's why obviously you're here and why you've looked into this. New home-based businesses created lots and lots of revenue, and new businesses are starting all the time. And so this is the right time. So let me ask you, let's answer this question. How have the ABS business owners survived the pandemic crisis? Well, I'm going to play a little clip for you here from a fellow who actually has some good things to say, but I think I need to stop and share the screen one more time by clicking on one more little button. Let's see if this helps you to actually hear this.
We had to figure out the new marketing paths with COVID-19, but we've done that. So
yeah. Well, I know that you're using our book, The New Thriving Medical Practice, because well, there's a copy right there with your name on the front cover.
Right. I've actually got one. I don't know if you all can see, but I've got one right here in my hand, and there's my name right on it. So you can see that. But this book actually has been a great tool because I sent this book to an orthopedic surgeon who called me and read the book. A gastro as well called me, a gastroenterologist, because of this book, and then also sent it to a dermatologist who's looking to grow his practice. And we went down and had he called us, or his office administrator called us, and we went down and had a face-to-face. But yeah, so we're making headway, and it's just changed the dynamic a little bit in terms of how you market. And fortunately, ABS was ahead of the curve, not knowing, of course, that there was a pandemic coming, but in providing multiple tools, different ways, different paths to marketing. And so this book has been really good for us because you have to nowadays get yourself invited into their space.
Yeah, so you said that you had just basically mailed the book out to 2 or 3 doctors with a handwritten note.
Yeah, that's what I did. So let's talk about the dermatologist. I had never met him before. I saw online, I was doing a little research. I found this dermatologist. I looked at their website, and I happened to see that they were hiring for somebody to do inside billing. And so I thought, okay. So I took out my book and put a little handwritten note in there and stuck it in an envelope and sent it to him. And a couple months went by because I did it pretty early. I would think it was before the pandemic. But once the pandemic hit, I think, there's a realization now with these doctors, like, oh, well, geez, my billing staff can't come into the office. I'm losing patients. There's all of a sudden a realization that there's trouble.
Okay, so I'm sorry. I guess that was just a little clip from an interview that I did with Dan Elliott. He's one of our business owners. And we also have a partnership with a doctor, Dr. Vicki Rachner. She's written a lot of books, and she's well known amongst the medical field. She speaks all over the country in front of groups of physicians, and she's been interviewed by some of the magazines and newspapers and radio programs that you see there listed on this graphic. Now, folks, the reason I bring this up is because Dan just told you that one of the secrets to this business is being able to meet with the doctors. And the way you do that, you can use some of our tools, like the book that I wrote with Dr. Vicki Rachner. Now, she wrote another book here I want to quote from, though, because it has a great quote. Some people don't realize that the doctors, when they file their insurance claims, they get a rejection rate of up to 30%. Well, with our system, we can bring that down to as low as 2 to 5%, which means more money in the doctor's pocket. And that's why in this book, The Myth of the Rich Doctor, Dr. Rachner says this may be the fastest and easiest way to increase your cash flow. Now, the reason I'm saying this is because books like this, we make available to you to actually use as marketing tools to get the attention of a doctor. A doctor does not want to be sold anything. They don't want to talk to any salespeople. And that's why our business owners, most of them, have never had any background in marketing or sales. We just use the right tools to get you in front of the doctor, and then the system sells itself. Here's 3 of the books, for example, that we developed. One of them just came out, that one on the left, this first part of this year. That's written by my son, Adam Phillips, who is the CEO of American Business Systems. He wrote that with Dr. Ragnar, 9 ways doctors let money slip through their fingers. And then there's also another one that Dr. Vicki Ragnar makes available to us, 10 critical questions for physicians in private practice. Now, these books, even though they're on Amazon for like, $24, $25 a piece, you'll be able to purchase these books. You get an initial supply of, I think, 20 of each one of these. But then after you've used those up, you can actually order more if you need them to get all the business you want. And they're as little as less than $5 a copy. So anyway, the point is, folks, that we've developed all that you need to be successful in getting clients. That's the biggest worry most people have starting any business. And we figured that out. Look, here's the New Thriving Practice, medical practice book, showing that your name can be on the front there, having written the foreword. Well, we've already got a foreword written. All we do is just put your name and contact information at the end of that. Now, if you feel like you should write your own foreword, you're welcome to do that with our guidance. We'll help you do that. And your name, of course, is always there on the front title page of the book as well. So, folks, these are some of the reasons why our business owners, sometimes we refer to them as licensees because they've licensed our whole system to be able to use it. They're just thriving because of this. It's also the right industry at the right time. Look at this quote. About 60% of baby boomers have also been diagnosed with arthritis, diabetes, heart disease, and hypertension. This requires them to have regular checkups on their health, take prescription medications, and look after their diet properly. Little wonder then that healthcare is one of the fastest growing industries in America, this article says. So, folks, just think about it. How many times is it the right time when baby boomers are retiring right now at 10,000 a day in the United States? So there'll be a huge, healthcare is just going to grow. That's all it is saying. Now let's talk about income potential. I mentioned that earlier. This quote says revenue cycle management. That's what you're doing, is managing their revenue cycle by helping them collect the money from the insurance companies and Medicare. The market size was valued at US $105 billion in 2020 and is projected to reach $249 billion by 2028. So in the next 6 years, basically, this thing will more than double. It's growing at a rate of about 11.22% from 2021 to 2028. Now, I know this graphic here is a little hard to see, so let me just say this. I'm going to turn off my video just for a second. I might make this a little larger on your screen. There may be some controls there on your screen that will let you zoom in on this a little bit bigger, or maybe you know how to increase the size of your screen. But you'll notice that this is right off of our website. If you go to absystems.com, down at the bottom, it says Income Calculator. There's a little link at the very bottom, Income Calculator. Now, what it talks about is the billing rate. This is what you would charge the doctor for your billing services. And most of our billing owners actually charge anywhere from 6 to 8, sometimes 9, 10%, depending on the doctor, the volume, and the specialty even. We can help you with all the pricing and give you suggestions. It's your business, but we can help you decide what you should charge. But let's just take an average of 7%. Now, the average claim amount is, we've got in here $150. That means when you visit your doctor, a visit could run $150, but maybe it's less than that for your doctor, or maybe it's more, depending on, again, the specialty, right? So you can plug in these numbers on our website in this calculator, just plug your own numbers in. But we're trying to be conservative here, and so we used 150. And then average number of patients that the doctor sees each day, we've got 25 in there. Again, you can adjust that up or down as you need to. I know I've been sitting in a waiting room to see the doctor, and sometimes there's 25 people to see him that hour. Maybe there's more than one provider in that office even. So how much money could you make? Well, depending on what these numbers are, as you can see in this example, your yearly potential income could be $68,000. Now, folks, that's always dependent, of course, on the type of doctors that you sign up and how many you sign up and how hard you want to work. But the point is that our licensing fee, if you've talked to one of our reps, is less than $29,000. And so for that investment to be able to make $68,000 from one medical practice office, this is just one client, it shows you the huge potential in this business. Now, why do we do that? As a company, we make money on all of the services that you can offer to doctors. And we'll talk about some of those here in just a second. But the point is, we make a few pennies on every transaction. So this is your money that you're keeping. You're not paying any of this to us. It's not a royalty situation like a franchise is. Here's another little clip I want to play for you. Again, you may need to turn up your volume if you need to. And let's see. This is a note here from Adonis. It says, could you please have the links for all of the literature that you're referring us to? Yes, some of the literature, of course, are the books that I just showed you. Your ABS rep can actually send those links to you as to where you can find those books. And if you want some of the quotes that I'm showing here in the slides, what we do is we print these slides out as a PDF and give these to our reps to share with you as well. So I'll give you a way to find out who your rep is here a little bit later. Okay, let's listen to this little clip here from Steve and Beverly Ryder.
All right, now I didn't ask you if I could share this email from you, this little note that you sent me, Beverly, but I'm going to throw this up here. I just thought it was a nice little note for you that you sent to me. You remember sending something about one of your clients and you sending an invoice?
I did, and I knew that was the email you were going to bring up, yes.
Yeah, we sent that around the office here. Everybody wanted to see that because Beverly is saying, she actually wrote this to Jordan in our office here. Says, one of my clients is receiving an invoice for $25,663.93.
They're making 3 to 4 times their previous income, servicing 400 to 500 doctors. Now, again, you may want to keep this business small, but you can build it as large as you want to as well. And we as a company make a few pennies on all the ancillary services, as I mentioned earlier. These are all optional. They're included in our license fee I mentioned earlier, but you don't have to offer them unless you want to. For example, you may not want to do billing for dentists. That's a whole different software and field. But it's all included, all inclusive. We're not going to charge you extra for any of these services, and you get marketing materials for all of them. Here's some of the professional flyers that we've developed for each one of those services. Oh, okay. Somebody said, yeah, can't hear you. What happened? No sound. I'm sorry. All right. Well, that's just me on a live webinar and not being able to get feedback and not paying attention to the notes in your chat. By the way, here's some of the reasons why our business owners thrive. We have an ABS network of support. Folks, we are the nation's largest network of medical billing companies. And these are some of the people from coast to coast that have gone through our training, have been successful at it, and that actually have volunteered. Well, I say volunteer, we pay them for their time, but they are knowledgeable enough about the business to actually mentor and coach new people. So you're not left alone. Once you start in our business, we've got people who are in business as well that will mentor you and coach you all from coast to coast. We also have unlimited lifetime support. Now, that's important that if you're looking at any other company, you ask them, what is your annual support fee? Some of them are $1,200, $1,500 a year after your first year or so. We include unlimited support, again, because we make money on the back end on the ancillary services that we just showed you. This is one of our support offices in California. We also have offices all over the United States because of the partners that we've partnered with, as I showed you earlier. Our professional marketing materials include postcards that are actually printed and delivered online through the internet. You don't actually print anything or mail anything yourself, and that's all included as well. Yeah, this is a real neat system. I wish I had time to go into this. Ask your ABS rep about our online marketing campaigns using postcards. It's just fantastic that it can all be done through the internet, and yet once it's set up, these cards go out on a regular basis, like once a month, to your doctor's offices and tell them about all those ancillary services that I mentioned earlier. We also include in your licensing fee a professional website. Folks, you have several templates that you can pick from and graphics. You can change anything you want to on it. It's very professional, and it would cost you probably $2,000 to $3,000 just to develop a website like that. We're the only company that has a true integrated system. Now, what I mean by that is that all of our systems, including the practice management system that does the billing, the electronic medical record system that the doctor uses to put in their notes and choose the codes that they want to use. The clearinghouse is built in as well, and the patient portal as well, all written by the same programmers. In our company, it's all integrated. We don't use any outside. Now, this is important. If you're using somebody else's system, ask them, for example, who is it that wrote this software for your electronic medical records, for example? Some companies actually use just open source software that's out there that they just kind of private label. And so it's very, very hard for you to integrate everything. You have to install software on your computer, on the doctor's computer. There has to be another piece of software that connects the two together. The patient portal is separate. And I'll talk a little bit more about the clearinghouse as well. It's a proven clearinghouse, as I'm showing you here. And it's wonderful because the patient can go to the patient portal, set up their own appointments, order medicine for the doctor to prescribe to them and so forth. And the doctor then, when they see the patient, can put all of his notes and everything in the electronic medical record system. This all goes into the same system, cloud-based, that behind the scenes, when you log in, you see all this. And it's already there. You don't have to type in the demographics for the patient because they put it in when they went to our patient portal. You don't have to type in the codes or the notes from the doctor because he or she put it in when they saw the patient using an iPad, for example. And the clearinghouse is actually built into our system. Now, we put that picture of that building there to illustrate that. It's not really on our software because this is sent directly from our system to the insurance companies. And that means that we are responsible for making sure that the claim gets paid. I mentioned earlier that most clearinghouses and software will reject about 30%, up to 30% of all the claims that are sent in. And then those claims usually just sit around and never get paid. With our system, our nationwide clearance rate is 98%. That is, we have a less than 2% rejection rate on our claims. What does that mean? More money in the doctor's pocket, and the more money the doctor brings in, you make 7% of that, 6, 7, 8% of that, and so there's more money for you as well. Here's another reason our business owners thrive. Live demos for your prospective practices. That's right. When you run across a doctor who seems like they might be interested, and maybe you give them a copy of one of the books I mentioned earlier, they then can see a live demo of our system at no cost to you or them. We have people, full-time demo people, that can do those demos. And so that's all inclusive, again, no extra charge. I don't believe in nickel and diming people to death. So when we say that the license fee is $29,000, that's all you will ever pay to our company. We have eligibility checking right there on the system. you can give access to the doctor's front office people so that they can check the eligibility of a patient by just putting in their insurance number. And our system goes to the insurance company's database in real time, live over the internet, and pulls in the information for that patient. So we know that the information is correct because we didn't put it in, you didn't put it in, the insurance company put it in. That's the kind of thing that causes those rejections on claims, is just little human errors because most systems are not able to do what you see here. Those are the kinds of things that when we show this on a live demo to a doctor, you can hear them in the background saying, wow, I've never seen anything like that. I didn't know that that could be done. Yeah, so it pulls in that information. You can add a picture of the patient even so that they can see all that right there in their system when the doctor is, using the EMRX electronic medical records system right there on their screen. Here's another reason our business owners thrive: live one-on-one training. Folks, our training is done by a licensee. That is one of the people who've been through our training. They are one of our business owners who've been through our certification for instructors and are now certified to teach you based on, of course, our information and our outline. You do it one-on-one with this instructor, by the way. You're able to ask them questions. Nobody else is on there but you and the instructor, or maybe you have a partner or a spouse that wants to sit in on as well. Here's the modules. There's 10 modules. These are all set up with you, with your instructor, according to your schedule. If you're wondering, each one of these modules takes about an hour and a half to go through. There is some homework that you'll do, but anybody who wants to can get through all of this in the first 30 days. And you'll see in a moment why that's important when I talk about our money-back guarantee. We also have a 24/7 support site. Now, folks, let me see if I can log this in and show this to you. I think I have to stop this and share the screen of the actual website. There we go. I think you should be seeing my browser now. And this is our support website live. As you can see, there's a news section where all the new items that come up are put right on the look. We've added something right there today. All the recent posts are listed back here that you can go back in time to see. And this is a live 24/7 support site, folks, that you can not only go to find the latest news, as you see here, but there's a whole section on getting started. When you're first getting started, you'll be able to go through the training modules here, learn about how to set up your business if you've never set up a business before. All about domain names, because you'll have to open up a domain for your website. They're very inexpensive, $6, $7 a month. And you'll be able to pick, of course, from the templates that I mentioned earlier for your website. They're all listed right here and shown, and you can click on any one of these to go in and actually see it, live. I don't know if you're seeing that or not. Yeah, I guess you are. Okay. All right, let me go back. And anyway, those websites are personalized for you as well. Here's all the different services, all the ancillary services that I mentioned. Here's a whole section on marketing and how we teach you to go out and find the doctors that are out there. There's a whole section on tools. These are custom books and letters and flyers and presentation folders and all sorts of good stuff here. Remember, we've had this site for about 12 years now, so there's a lot of information on there. Anyway, I just wanted to show that to you. I thought that might be of interest to you to see exactly what that's all about. Let me see, how do I get back to my slide? There, okay. So that's available to you 24/7. It's a private site. You'll have to log in. Of course, we have a login for that. We also have a private Facebook group that you can join. Looks like there's 199 of our business owners that are on that Facebook site. So you can go there 24/7 and actually communicate, ask questions, and share things with other business owners from coast to coast, people who've been in the business just recently, and those who've been with us for 15 years or more. We also have ongoing motivation and support webinars. Now, these are important, folks, because you need to hear not only from other business owners, but you can see my cell phone there. This is Tim. He is a business owner, but he's also our support guy that's in charge of support and directs you to the right people that can support you. And we also have educational webinars each about twice a month that will keep you up on what's going on in this industry. We also give you professional certification. I mentioned MIRMA earlier, and MRMAA.org is the site that you can go and learn more about that. This is the organization that actually certifies you as you go through our training. And when you get through it, your name is on the certificate as a certified medical revenue manager. There's also ongoing training. Now, this is not a very good image, but we're trying to illustrate to you here. This is our Vimeo site, I think, where we store all the videos. We literally have hundreds of videos of further training that are available to you. And we do live webinars on a regular basis for our licensees to keep you up on what's going on in this industry. And you can pick any topic you want, and we've probably done a webinar on it, and you can rewatch that as many times as you want to. Again, available to you through our website, the support site I showed you earlier, at no extra cost, of course. Here's another little clip I wanted to play of one of our licensees. And let's just see what. Let's just talk about your business, Wendy. When you first came through the training, what did you do to go out? Sorry, her name is Wendy Bruno. And market. How did you get your first client?
We got a client from the internet.
Well, and so that first client came because they saw your website and said, I think I need some help. And so doctors really do go out and search for help with their billing, don't they?
Yes. And, with our internet marketing and stuff like that, the vast majority of the info requests that I get via email from them typically come in, in the evenings, weekends, and stuff like that. So when these doctors are sitting there, they're looking at their numbers, and they're, when things are quiet, the staff's not around, and they're like, well, what's going on here?
Yeah.
So that's usually when we get the vast majority of our info requests.
So have you gotten referrals from some doctors to other doctors?
Yep, we've gotten referrals from doctors. Our current providers, we've gotten referrals to.
All right, so let's jump ahead in time just so people can see where you're at today. How many clients do you think approximately?
30, 40 clients. I should know the number off the top of my head. I know we have quite a few. We have quite a few clients, and we're, the vast majority of my clients were in Ohio, and then Georgia and Texas and New Jersey and stuff like that. So we're kind of all over the place at this point. We have a doctor down in Florida that we do scheduling for. We're an outsourced scheduling company for them. So it's we do a little bit of everything, and we don't have one specific specialty that we bill for. We kind of work with all of them. There's not been one that I have said no to. I take.
It doesn't matter, does it? There's too many different types of doctors out there. So I know what you're saying, because every time I interview a licensee, they're usually not clear as to how many clients they have, because you count a client, of course, as a practice probably, and yet some of those practices have multiple providers or doctors. So that number is.
We have a counseling group that, they have over 100 providers at that group. So they're all different sizes.
Yeah.
Mm-hmm.
Now you have some employees now, right?
Yep, I do. I've got seven employees working with me. We actually just brought on another one just recently within the last 2 weeks. But they're all working in my office in Westerville. I told them all, I said, hey, great news. I said, if you decide to pack up and head south, I'm like, we can open up an office here in North Carolina. So I'm like, at least we've got that going for us.
Yeah. Well, they could work from home, I guess, if you could monitor them. I don't know.
And they did. They did during the whole COVID thing. We had everybody pack their stuff up and just basically work from home during that time frame. And you know, it was no question of, oh, I guess we're just gonna have to stop billing or anything like that. Like, you know, it was full steam ahead. You know, we do what we got to do to get these providers paid. And I certainly didn't want them to have to suffer, my employees for sure, but then also the doctors and the doctor staff and all the people that they're taking care of. So I can't just pull the plug and say, oh, sorry, we're done for 3, 4, 5 months or whatever we're going to at this point.
Right.
This is the beauty of ABS, is that it doesn't matter, like you get, you know, they get you set up with all of the tools and stuff like that you need to go in and start your business and to run with it. But at the end of the day, it is your business and you can do with it whatever you want to do. If you want to provide scheduling services, provide scheduling services. If you want to, we do credentialing for providers. But we do, we don't do collections and stuff like that. We send out patient statements. I have billed for anything from schools to home health care companies, surgeons, family practice, chiropractic, mental health. You name it, I've probably billed for it at this point, or somebody in my group has. But it opens it up to just about anything. I mean, you do with it as you want, which is the great part.
Folks, all of those other ancillary services that we mentioned earlier, you can make money on. And we as a company make money on those too, by the way. That's how we provide you lifetime support, because we make a few pennies on all those transactions. But let's face it, the big money is in the billing. That's what you want, is a doctor's billing, because if a doctor's billing $100,000 a month and you're charging 7% of that, that's $7,000 a month that you would be making off that one doctor. So, hey, that brings up a question here that Alan is asking. He says, so where's the $1 million? Show me the money. I titled this, you know, how you can, you know, start a business making $1 million working from home. So let's just do this. Just for a second, I'm going to go to my Safari browser here, and there's live on our website. And up here at the top, I don't think this is showing right now because I've got this too narrow, but there's a menu up there about income potential. So what I wanted to do is just plug in some numbers here. Now, we've got some already plugged in, but let me talk about these just for a second, Wendy. You said you had 30 to 40. Let's just put 30 in there just to see what happens. 30 clients. Average number of patients each doctor sees per day. Now, it's got 20 in there. Are there doctors seeing 20 patients or more or less, or is that?
It depends on the practice. Like, you know, I mean, I've got some practices that see, you know, I don't know, probably 50 patients a day. I mean, there are some practices that go hog wild, all crazy. So it just depends on the practice, how many doctors are in that practice and that type of thing. So. And
are most of those doctors open 5 days a week now, you think?
Yeah, actually I think almost all of mine. I've got some that are 6 days a week. Most are 5 days. Most are definitely 5 days, though.
All right. Now it's asking for the charge, and just to explain it to people, I mentioned earlier 7% because that's probably an average, but you don't charge every client the same. It depends on their volume and the type of doctor and all kinds of things. But what would you say the range is there? Does it go down to 5%? Does it go up to 8, 9%?
Yeah, I mean, we've got anywhere from, I've got some 4 all the way up to 8%, just depending on the size of the practice.
Yeah. All right. Well, let's just leave 7 just to see. We can always plug something else in there because, folks, you can do this yourself on our website. Average claim now, it's saying about $100. Does that sound low in today's world?
No, that's probably pretty good. I mean, if you're looking at like a family practice, that's probably about right.
It is. Okay.
$100 per visit.
All right, so let's hit submit here and see how much money she's making. There's that $1 million I was looking for right there.
Yep. That
now,
sounds
folks, right. Look, here's the disclaimer. Not everybody who says they lost 150 pounds on those weight loss ads on TV lost 150 pounds. And the same thing is true here. Not everybody's going to do the same amount of volume. They're not going to build it as big as Wendy has. She could have kept this as small as you wanted to, right? You could have turned the business away. She just wanted to grow it to the point where she can sell it someday and buy that McDonald's that she's always wanted.
I'm going to go park myself on a beach somewhere.
There you go. Hey, you get it to a certain point and you could sell it because it's a cash flow business, right?
Yeah.
And with a certain amount of cash flow coming in,
you can say,
Yeah.
okay, this business.
Okay, well, I just wanted to cut that short because we're kind of running out of time here. But as you can see, the possibilities with this business are endless. All right. Now, if you're interested still in knowing how you can get started in this business, it's real simple. We have, first of all, a risk-free money-back guarantee. Now, let me tell you why we came up with that, because I came up with this because this is the way I would want to buy a business like this. I don't mind paying a fee like we have, or a franchise fee if you're buying a franchise, like a Subway sandwich shop or something, as long as I realize that I don't know everything there is to know about this business when I first get in it. What if a week later I decide that I shouldn't have done this, or there's something I don't like about it? So that's why I came up with this a few years back. Folks, nobody else that I know of does this. I'll let you go through my training, all 10 modules, as long as you complete that, in the first 30 days. It's a 100% money back if you contact us and say, even on the 30th day, and say, look, I just decided this is not what I thought it was. I want my money back. We would rather give you your money back and you go on and find something else that fits you better than to keep your money. So anyway, if you're looking at this business with any other company, ask them, what's your money back guarantee? And see what they say, because I don't know of anybody that offers that. Okay, there's our phone number on the screen and an email address that you can email to if you don't know who your rep is. And you can always just call or email us and ask us. Because I'm going to tell you that some of the steps you need to take are to look over our downloadable research guide. Now, you may have already gotten that from your rep. If not, be sure and ask them for that. It's a 65-page PDF document that has information in there that you will not find anywhere on our website, because we want only people who are sincerely interested in getting into this business to have that information. Number two, browse our YouTube channel. Those interview clips that I've shown you today are all out there on our YouTube channel, and there's over 100 of them. So you can go browse and listen to as many of those interviews as you wish. There it is right there, youtube.com/YABS. You see it right there? Yeah. Okay, and well, that's what it looks like. That's the actual YouTube channel, and it's got literally hundreds of videos on there. Next, ask your ABS rep, your owner, for an owner reference list. Now, that's just a list of people like these who are our owners that have agreed to take a phone call now and then. And when you do, you can ask them all the questions you want. We don't tell them what to say. That's all up to them. And you can ask them, exactly what you want to know about the business. So I tell people, don't believe what I tell you on these webinars. Ask people who've been through the training, who invested the money, and are now, doing their business and experiencing our support. Ask them how it is. Okay, next is a live demo. I mentioned that earlier, and if you haven't seen one, be sure and ask your rep for a live demo. We'll set it up so that you can sit at home with you and your spouse. Our demo person will give you that explanation of what our system's all like live over the internet. Takes about 45 minutes. So just set aside a little time and find out. You will be very impressed with what you see. It's the same demo that we give, of course, to your doctor prospects that you run across. Next, review the purchase agreement and the funding instructions. There's only 4 pages. This is not a real long 30-page legal document. It just tells you exactly what you get, what we're going to do for you, what the money back guarantee is all about, and exactly how to get your funds to us. That's the last step. Send in your agreement and the funding and schedule your training. Now, if you're not sure how to come up with funding for a business, our reps can help you with that as well. So be sure and get with them and let them help you with all of these things. Folks, I don't know what else to tell you other than the fact that if you set up your training with your individual, like I said, your individual instructor, we'll let you talk to that person, he or she, individually, and set this up according to your schedule, because everybody has different schedules, and we'll make sure that we fit in with your schedule. So I'll just leave this on the screen here as I say goodbye to you. Next week, we're going to be interviewing one of our business owners. So you might want to check that out. We have these webinars every Wednesday at 4 p.m. Central Time. So if you have any questions that I didn't address today, I don't see any more in the chat or the Q&A box, just be sure to get back with your ABS rep using the phone number you see here or the email address here. Just email us and let us know what you need, and we'll try to get that to you. I hope I see you on one of our upcoming training systems modules. And once you have joined us, I'll be calling you myself personally and congratulating you and talking to you about the next steps for you to be successful in this business. Thanks again. My name is Patrick Phillips. I'm the founder of American Business Systems, and I thank you for your time today. Bye for now.